Hi, my name is Dr. Jordan Carcaville. I'm a cosmetic dermatologist and Mohs surgeon, and today we're going to tackle a really common problem, acne scarring. If you've ever wondered how to treat acne scars, you're in the right place. So let's dive into it. Question 1, can acne scars go away on their own? Some acne scarring will fade, and that can be pigmentary types of scarring or superficial scars that can fade over time. But a lot of times we need to intervene and use treatments such as lasers, microneedling, deep peel, subcision, the list goes on. So there's lots of treatments that we are happy to discuss with you. Question number 2, what is the best treatment for acne scars? As I mentioned, there's lots of treatments for acne scarring. And it really depends on the type of scars that we're dealing with. If it's a pigment scar, if it's a deep pitted scar, or if it's a rolling scar, there's different types of acne scars. And so there's different types of treatments available for that. Sometimes we can get away with topical treatments that will help lift pigment out of the skin, or slow topicals like retinoids that will help the surface of the skin. But those take quite a long time. They're still great, and they're good adjunct treatments as well. I think the best treatment for all acne scarring, the gold standard, is going to be a CO2 resurfacing laser. It's a fractionated resurfacing to re-injure the tissue, and so it heals with better texture and less lumps and bumps. Question number 3, how long does it take for acne scars to fade? Well, with treatment, it can take up to 6 months to a year to start seeing. So when I'm doing a laser for a patient with acne scarring, yes, the skin will look brighter within the first month, first few weeks of treatment. But to really get those acne scars to remodel, the tissue to contract, and the scarring to fade, I would say give it 6 months to a full year. Question number 4, do home remedies work for acne scarring? My first reaction is no, they're not going to do very much for you because it's not really using the science-backed measures that we know work really well, that are solid. I do think that we can get some benefit from, for example, honey, which is antimicrobial, that has data behind it, but that's treating acne, for treating the bacteria that can cause it. For actual acne scars, you really need to re-injure the collagen to help that remodel. And you can't really do that with just gentle botanicals or at-home remedies. Scientifically backed treatments such as resurfacing lasers, subcision, strong peels, those are actually serving to re-injure the collagen that's been injured from the initial acne pimple. So when we re-injure it with control and we have it heal in a controlled way, we start to get better skin homogeny. In other words, skin homogeny is more smooth skin, less texture on your skin, less pock marks, less pore size. So skin smoothness, skin homogeny. Question number 5 is, can I prevent acne scarring? Yes, you can actually prevent some acne scarring by controlling what you're doing at home. And some of the biggest reasons we get scarring is when we have too much mechanical manipulation of our scar. So that means pressing on it, pushing on it, squeezing it, really manipulating it, trying to get something out of it, because we don't always have something to get out of. So you want to avoid manipulation, which is going to create further inflammation. Inflammation will result in more scarring and more damage to the collagen. Sometimes your acne is going to be very inflammatory just at baseline, and you might be someone who suffers from inflammatory pimples and nodules and cysts. And so even if you don't manipulate your skin, even if you just are, suffering with this category of severe, moderate to severe acne, you can still scar despite, any of your things that you can do to control at home. Sometimes if you have inflammatory acne or severe red pimples, cysts, nodules, those are deep pimples and they create lots of inflammation on their own. So sometimes you cannot prevent the scarring and it just is going to scar because of all that inflammation that's causing damage to the tissue. The best thing to do is talk to your dermatologist, treat the acne, get on a treatment plan for the scarring, and develop the most individualized plan for you. If you found this video helpful, feel free to subscribe. If you have any questions or comments, feel free to drop them below. Thanks so much.